series. Sir, with your permission, should we start?
Yes, of course, please.
Bismillahirrahmanirrahim. Assalamu alaikum and good day, ladies and gentlemen. I am Hazima Mozam, and I welcome you all to another exciting webinar organized by Comstech. The title of the talk of our webinar is on One Health Approach to Zoonotic Outbreaks. And this talk will be delivered by Dr. Tariq Mahmood Ali. Dr. Tariq Mahmood is the Dean of Social Sciences and Associate Professor of Health Economics, working at a premier institution health institution in Pakistan, which is Health Services Academy. Dr. Tariq, on behalf of myself and Comstech, I would like to thank you for being part of our webinar series. And I would also like to thank our participants for joining from different parts of the world. With this, I would now request my senior colleague, advisor Comstech, Professor Dr. Khurshid Hasnain, to kindly introduce and welcome our guest speaker for today.
Thank you, Hazima. Welcome to all those online participants who are waiting to listen to this very interesting seminar or talk. And let me just put this in a little perspective. This is the Comstech webinar series, and the current lecture that you will be hearing is the 36th lecture of this series. It was started, this series, in 2021, and particularly because of the era of the pandemic and the COVID-19, we have been focusing on many such aspects of the pandemic control and pandemic handling of this. So we are very happy that today we have a speaker who will be talking to you about this important aspect, which is a One Health approach to zoonotic outbreaks, which is essentially, as you would be aware, emphasizing the interconnectedness of the human, animal, and environmental health in addressing these infectious diseases that spread from animals to humans. Dr. Tariq is, of course, eminently qualified to talk about this subject. He's the Dean of Social Sciences and Associate Professor of Health Economics at the Health Services Academy, as Ms. Khadima just introduced. He has served in various positions and academic positions in distinguished institutions in Pakistan, and his academic background, of course, also is very appropriate. He has a bachelor's degree in statistics, mathematics, and economics, and an MSc in economics and a PhD in economics from the University of Manchester, UK. So with this brief introduction, I request Dr. Tariq to please present his lecture.
Dr. Tariq, you have to unmute your mic.
Thank you, Professor, giving me an opportunity to deliver a lecture on a very important topic on One Health approach. So let's give me a few seconds to share my presentation with you. Yes. I think my presentation is visible.
Yes, it is visible. Can you please put it on slideshow?
Yeah. So thank you very much.
Your presentation is not on the slideshow.
Okay.
Yeah, it's okay now.
Okay, thank you very much. The One Health approach, basically, I'm very highly grateful for the participant who accepted this invitations. I'm glad this is a very important topic to discuss recently. This is give you to a brief introduction to One Health approach of zoonotic approach to give you a brief introduction to the One Health approach to zoonotic outbreak. Before we go to in details with perspective from human and animal health, I first want to make sure that you are familiar with the basic concept of One Health. Basically, my presentation is comprised of three parts. One is the basic overview of One Health approach, and the second part is human health, and third part is animal health. So let's start with the first. What are zoonoses? So the zoonoses are communicable diseases originating from the animal population that can affect the human being. We speak of zoonotic outbreak when such diseases spread with an increasing number among the human population. When we look at deadly disease such as rabies or rapidly spreading airborne infection such as SARS or bird flu, you will see the huge impact on human disease burden and economy of such genetic outbreaks. So, and because the interaction between the human and animal population is getting increasingly more intense due to our travel, the way we manage animals for food and the increasing rate with which we destroy the natural habitats, we must expect to see more and more significant zoonotic outbreaks soon. If we want to reduce the risk and impact of zoonotic outbreaks, we had better understand how genetic diseases are amplified and transmitted among the animal population in the wild, among the domesticated animals, and between those animal populations. So it is also important to consider the transmissions between the animals and the human populations. Through the direct contact or a vector, such as mosquitoes, flies, and ticks. Lastly, some genetic outbreak can spread rapidly. The COVID-19 impact pandemic has painfully reminded us that outbreak can rapidly spread across the globe, not only affecting the individual and society, but the world as a whole. So you see that to understand genetic outbreaks, we need to look not only at the human sectors, but at animals and the environmental sector as well, and an intersection to stop or even prevent genetic outbreaks should also be coordinated between those different sectors. That is what the One Health approach is all about. So first, One Health is a vast and at the same time straightforward concept. It covers the human health as well as animal health and environmental health.
Dr. Tariq, are you with us? We cannot hear you. Dr. Tariq? dear participants, our speaker has some internet issues. He will be joining the talk, the webinar again, so kindly wait for a few minutes. Yes, Dr. Tariq, please continue. We can hear you.
Ma'am, I am audible?
Yes, yes, sir, you are. We cannot, there is still a distortion in your audio.
There is distortions.
Yes, now it's okay. Please go ahead. Yeah.
Okay, thank you. So, well, looks the interaction between these three sectors: environment, animal health, and human health. So, let's look to example. Let's say this imagine sectors intersecting.
Dr. Tariq, do
Yeah.
you have an extra mic? Because there is some problem with your audio. It has some noise with it.
Okay, I'll try my best.
If you're using your headphones or anything, maybe you can use your
Okay,
system.
I use headphones. Okay.
Huh?
Hello.
Okay, now it's clear.
Okay, thank you very much. So let's illustrate how these three sectors are intersecting as intersecting circles, like in this diagram. Do you know, see how these sectors overlap? Now let's imagine the introduction of new influenza A virus, for example, H5N1, carried to our country as flock of migratory birds. This may contaminate the environment around some forms with their droppings, or they may directly have a contact with other domestic wildlife or farm animals. Or farm animals may become infected, causing large outbreaks among the poultry. This may infect the farmers, their personnel, and their families at the first, and they may then transmit this new virus to their neighbors, friends, and other people in this country. The infected wildlife and the farm animal may contaminate the environment, for example, at slaughterhouse or live animal markets, and contaminated surface, water, or
Dr. Tariq, we cannot hear you at all. There is a lot of noise in your voice. Kindly try to switch your device from which you are connecting. You can send your presentation to us in the chat box and maybe try to use another laptop or the mic because there is some problem with your mic. Participants, we are really sorry. There seems to be an extreme sort of internet connectivity issue and problem with the audio of Dr. Tariq Mahmood. So please bear with us for a few more minutes.
On this slide, I'm sorry, due to some technical issues, we are unable to present properly. Let's start with the last slide as the transmission of new influenza virus from animal health to the human health. So we have already discussed that this is just one of the example of how health links with three sectors. As we have already stated, I hope you will listen these things. And next we move to the next slide. Dr. Hazima, now I'm audible now? Hello?
Yes, sir, you're audible. Please go ahead.
So thank you. So the next, you probably have heard already that One Health recognized 4 distinct disciplines: preparedness, alert, response, and recovery. So we discuss all these 4 stages one by one. The first one is the preparedness. So during the preparedness phase, there's not yet any single sorry there's not as yet any single of problem. Still, the identified risk factors are increasing and the likelihood of an outbreaks appear high. This phase must be used to prepare and get all the process and resources ready for the next phase. What do you think is involved in this phase? Well, think of everyone needed to monitor and assess alert signals of possible outbreaks. Everyone that is needed to respond to outbreak when they're detected, and everyone needed to contribute to the recovery after an outbreak. So the preparedness phase is about the bringing people together and agreeing with them on working together in each of the following phases. The second phase is alert phase. When suggestive clinical cases are reported in animals or human, here everyone should be in place to do what is needed to pick up signals of possible outbreaks or emerging diseases. This means that many data needed to be collected and analyzed regularly and continuously. In other words, surveillance of communicable diseases. During the alert phase, we look for signals of spillover of infection from one population to another. Sorry. This could be due to changing migration patterns, changes in vector population, or changes in human behavior, including activities
that changes the ecosystem. Such a spillover event could first occur between the wild and the domestic animal population, when this followed by the sufficient transmission within the group, in other words, amplifications, then the spillover of the next population may be matter of time. Once it is confirmed that more genetic infections than expected occur, in the animal or the human population, then this is the confirmation of an outbreak. As soon as possible, we need to know and to move to the third phase, outbreak response. Here is our aim is to interrupt transmission and to crush the epidemic curve so that the situation return to the normal. Sorry, we will look into the much more detail of this phase in our next part. The fourth and the last phase after the outbreak is over. Here, we need to work on the recovery of the affected population. This also includes learning the lesson from the evolution of the previous phases. So this is what I wanted to say about the 4 phases in nutshell. I will give you some more detail from the human and animal health perspective in our next part. Right now, I want you start thinking about the stakeholder that should be involved in this phase. During our next part, I will give you some more information on that topics. So now, so far, we have talked about One Health. But what is this exactly? Shall I tell you a secret? When it comes to detail, then it depends a bit on whom you ask. For example, when we ask the WHO, they will say that One Health is an approach to designing and implementing programs, policies, legislations, and research in which multiple sectors communicate and work together to achieve better public health outcomes. And when we then asked the World Organization of Animal Health, they stated One Health is a collaborative global approach to understanding risk for human and animal health, including both domestic animal and wildlife and ecosystem health as a whole. So, and other stakeholders have slightly different definitions. No, why should we take One Health approach? Well, first, it ensures the inclusive engagement, participation, and contribution of all sectors. How? By providing equitable platform where the multiple sectors representative co-own process and outcomes of a joint responsibilities. Secondly, it has benefit from economic point of view. You can imagine that working together is far more efficient than working in silos. So in practice, ensure the balance, equity in representation, authority, and responsibility. Then gained efficiency through the collaboration results in a tangible economic benefits. In practice, we have seen a 35% cost saving with a Rift Valley fever One Health intervention in South Africa and 26% cost saving from integrated human animal laboratory diagnostic in Winnipeg, Canada. And the WHO estimates that One Health approach at the country level can yield 30 billion annual returns of investment for disease prevention and controls and rate of returns so far. So in addition, the One Health approach can be seen as equitable platform for community participations. This is a benefit if we want to identify the most appropriate interventions. It also allows us to include social and cultural norms and believe in the interventions. This is especially important if these interventions depends upon the people changing in their behaviors. community engagements will facilitate risk communications and help us to identify the gaps in knowledge. It also helps us to identify the rumors and misinformation that may circulate in the communities. Last but not least, the community and influencers to help reach affected populations, trusted and influential people within the community who do not hold an official positions. This requires building relationship of the trust. So now I have talked a lot about One Health. Perhaps I can tell you here some experts in the field who have worked applying the One Health approaches. Just I show one of video, the experts who performs on the One Health approach.
My own experience started during the pastoralists. These are livestock farmers who move around with their cattle, sheep, goat, and camels in search for fodder and water. They have virtually no access to healthcare because of their mobile lifestyle. The crucial question was how to provide healthcare to them. Together with our Chadian partners, we created a team consisting of doctors, veterinarians, microbiologists, and geographers. We studied both the health of people and of their animals at the same time. To our surprise, we found that more cattle were vaccinated than children and women. No child had received the usual childhood vaccinations completely. We then met with the Chadian health and veterinary authorities together with communities to discuss these topics. In this situation, it was essential to engage with the stakeholders. As a solution, we created joint teams out of veterinarians and doctors. When veterinarians went out to vaccinate livestock, they took along public health nurses who could vaccinate children and women and provide quality drugs and health education. In this way, we made preventive health services available to people who would have otherwise no access to it. And that clearly created an added value to a closer cooperation between doctors and veterinarians. Due to the shared transportation of nurses, veterinarians, and vaccines, an amount of money has been saved. This example shows a fundamental principle of One Health methods. By subtracting shared approaches from divided ones, One Health benefits in terms of better health of humans and animals, in financial savings, environmental services, and a reduced time to detection of diseases.
Now I can hear you ask.
So why is not everyone working with One Health approach? So one of the problem is there are still many challenges in real life. Somehow sectors have the tendency of falling back to their own silos. So everybody is working in the silos. So now we listen to some challenges, listen to these experts talk about the challenges that they have encountered. We know during the outbreak, everything goes very fast. Let's see the next video of the experts telling about the challenges.
As for an outbreak of a vector-borne disease, a zoonotic disease affecting both human and animals, and immediately was a high pressure. I remember a press conference when the Minister of Health and the Minister of Agri had to go together to go and respond to difficult questions in the press. And obviously they were not really prepared. So in fact, they were delivering some conflicting messages. One of them saying, for example, that the animals in the meat were not dangerous. The other one saying the opposite. and then creating a lot of confusion in countries. So the people started to be very, very confused and create a lot of panic in the population. The impact was even worse because of this hesitation, we could immediately see a drop in the price of livestock, animal not being slaughtered anymore, animal not being sold anymore. And this attracted a lot of external traders from neighboring countries coming to enjoy the opportunity of having good price for buying livestock. And then by doing that, they exported the disease outside the country. So the impact was huge by just the fact that said were not aligned during the press conference. And I mean, we should not blame that because everything is going so fast that if you are not really prepared, if the coordination is not already well established between the different authorities, if the mechanism for immediately coordinating the message are not in place, then this is the sort of things that will happen.
Okay, now you've heard about
So thank you very much for listening this video. I hope you have learned about the concept of One Health approach. Now I will move, this is the end of first part of my presentation. Now I will move the next second part of my presentation, human health perspective on One Health zoonotic outbreaks. First, let's discuss what we mean by public health and explore what is unique to that perspective. Then we should spend the time on various phases of outbreaks and see how One Health approach can be used along the frameworks. Covering these phases, which are typically 4: preparedness, alert, response, and recovery. How are these phases shaped in the human public health systems? Next, we will touch upon some challenges. One Health is a mindset. Practice yourself in imagining possible problem and yours work and thinking of ways to mitigate them. So make sure you pay attention. So what is a public health? When people think about this term, they often think about the doctor and nurses, medicines and treatments, hospital and patient. But that's only a part of public health, namely healthcare, focusing on individual patients who have to be treated. World Health Organizations define the public health as the art and the science of preventing diseases, prolonged lives, and promoting health through society organized efforts. This is the definition given by the WHO. So public health is about keeping the people healthy and improving their well-being, and since disease risk can occur everywhere. So the public health sees prevention as a part of our society, focusing on entire population. Some groups of the people may be at high risk of infection diseases. Such risk differences may have biological reasons such as age, behavioral reasons such as kind of work you do, environmental reasons where you live. Now the people can be tricky to manage when it comes to the implementing prevention or outbreak prevention and control measures. Some of us may have conflicting priorities, but be less aware, not feel concerned, hear false information or conspiracy theories. And a public health message may not reach some groups. Our attempts to change the people's risk behavior can fail in many ways. Actively engaging communities in the designing prevention campaign, increase the impact of the campaigns. So while the public health thinks population level, and any decision to control the disease will always be shaped by the moral, medical ethics, and the individual values. This perspective is very different from the animal health sector and can potentially lead to the conflicting viewpoints on priorities. So to make public health work, all stakeholders must collaborate, and a Ministry of Health or a public health agency has to manage and direct all these stakeholder actions. Who are these stakeholders? You may ask. Well, think of National Health Institutes, policymakers, epidemiologists, laboratory scientists, local health department, clinicians and practitioners, community leaders and religion groups, community health workers, traditional healers, business leaders, educators, journalists, and social media influencers, and you. Since each of these stakeholders can make a decision that impact other health, you may understand that all of them can contribute to protecting health, and during a health crisis, we need all help we can get. In the case of zoonotic disease, that mix becomes even more complicated, widening to include the Ministry of Agriculture, Livestock, and Environment, veterinarian, para-veterinary workers, farmer, and smallholders, laboratories, veterinary laboratories, meteorologists, entomologists, and potentially more. I'll come back to that in our next and final part. Finding the right contact and building trusting relationship takes time. That's hard during the crisis, so you must invest in this during the preparedness phase. And speaking of the preparedness phase, it is the first of 4 in One Health framework for dealing with zoonotic outbreaks. As we already discussed, the framework looks like this: preparedness, alert, response, and recovery. So these 4 steps of the frameworks are similar to the approach of the public health emergency response in human health. Let's turn now each of these to see what they involve. The first phase is preparedness. So the preparedness, the most vital work in the response to any outbreak, gets done before the crisis occurs. Here you have time to do groundwork and put system in place for an effective response to future outbreak. A big part of preparedness is building relationships. People tend to work best together when they have met before, understand each other, roles and responsibilities and capabilities. And when they trust each other, that process needs fostering through the meetings and interacting with each other regularly. So find out who those people are in your situations and get to know them, perhaps by covering regular meetings, discussing diseases that might arise in your locality, joint training events, together collaborate on joint surveillance and risk assessment, or have a simulation exercise together. It may not seem so when you have a pile of other things to do, but this kind of activity is time well spent. So I mentioned the close relationship between the public health and healthcare. During crisis, a vital objective for public health is to ensure and care continuity to those who need it. Development of contingency plans, for example, is an essential part of public health and preparedness, as are contingency plans for essential public health operation. Do you want me to remind you of the essential public health operation? So Well, there are 10 public health operations, of which we consider following 5 as a core operation. First one is surveillance of population health and well-being. And second, the monitoring and response to health hazards and emergency. Third, health protections, including environmental, occupational, food safety, and others. Fourth, health promotions, including action to address social determinants and health inequalities. And fifth, disease preventions, including early detection of illness. So you can imagine that when we prepare for zoonotic outbreaks, we need to take a joint approach to these essential public health operations with animal health and other sectors. For example, consider preventing infection spread within the human animal population through vaccination programs and health promotions campaigns. Lastly, training and exercises can be great for testing these plants and revealing where their weaknesses are. They can also be valuable opportunity for meeting your animals and environmental health counterpart, also networking with your wider colleagues in human health. All these things are great for relationship buildings. The challenges with preparedness is managing to convince people to continue to invest in it when there is a conflicting priorities. It is easy for other things to seem more pressing and for preparedness to slip down the agenda. But this is false economy, because without adequate preparations in advance, it is merely impossible to respond effectively. So the alert phase is where your early warning take place. So signals from surveillance and monitoring activities need to be validated and assessed. So similar signals may arrive in different forms. It may be direct or indirect. So professional networks or unusual trends indirectly health linked indicators, such as absenteeism or consumption of drugs. It may come as reports on social media of unusual things happening in animal population nearby, or it may come as a phone calls from your animal environmental health colleagues that something out of the ordinary has happened, such as meteorological forecast of heavy rains, leading to increased flooding and stagnant water, increasing the risk of mosquito-borne diseases. By this time, you should have used the preparedness phase to put all systems in place that you need in event of an outbreak. You can now undertake the joint investigations and risk assessments to understand whether there is a reasons for concerns, depending on the assessments. You can launch communication campaign and alert all the stakeholders we discussed earlier of the imminent threats. If the suspected outbreaks might cross border, each country has a national HR focal points. They are responsible for communication with WHO regarding cross-border health threats. So the alert phase is all about identifying and assessing an imminent threats and preparing the appropriate response. And especially in the suspected zoonotic outbreak, coordination between the human, animal, and environmental health is critical. In this phase, you need a joint approach to assess the risk, ensure the rapid confirmations of an outbreak, and assess what resources the joint response to an outbreak needs. Hopefully, I have convinced you that much work goes on before we get to this part, outbreak response. So this part depends on the foundation that you have laid in the preparedness and alert phase. And even with the best prevention and preparedness activities, zoonotic diseases outbreak can and will happen. So what does the response phase entails? During the outbreak response, we need to activate the multi-sectoral structure described in your contingency plan. This structure should coordinate the outbreak response. We need to mobilize and upscale the resources available to deal with the outbreak, for instance, increasing laboratories, and especially by utilizing private research labs, or increasing human resources for essential the public health operation through the redeployment of staff. We also must intensify the effort to find the human cases and understand the extent of the outbreak through the surveillance and case finding activities. It is crucial to engage and inform the public through health promotion and communication campaigns that harness the traditional media and social media community leaders. The focus is to educate the people on how to protect themselves and reduce the transmission. And we need to support patient management and effective infection control in healthcare facilities, for instance, through the provision of adequate personal protective equipment. While we're doing this, we need to remain in close contact with our colleagues in other sectors to inform each other, since they will have additional and complementary tasks to tackle the parallel jointly. So you can see that the outbreak response is a busy time with many activities going on parallel. So it is essential to have predefined structures and system in place. Otherwise, it can all rapidly becomes a confusing mess where nobody is sure what everybody is doing or what needs to happen next. But you wouldn't find yourself in that position because you will have done your prep work and you will already know all your own One Health colleagues in this relevant sector as well. However, no matter how well prepared your contingency plan and preparedness activities are, you must remain flexible. There is always much uncertainty about how the disease will spread and what factors become important in any outbreaks, particularly of zoonotic or newly emerging disease. Be prepared to be flexible and agile so that you can respond not only to the situation you planned, but also one you didn't. Flexibility and agility are a part of One Health mindset. Outbreak always threw up surprises, but that also part of the professional funds. After all, busyness of responding to outbreak, you may want to have a long holiday or at least long lie downs. So now it is a fourth phase, recovery phase. Now it is vital to thank everybody who has worked so hard to control the infection. Each outbreak is disruptive and can affect the people's lives and livelihoods in many different determinal ways. If you want to maintain a goodwill of the people, you have been working with essentials to recognize, acknowledge the hard work and sacrifices they have put to bring epidemic under the controls. Next, it is crucial to look back what you learned throughout the outbreak. What part of contingency plan worked well and what didn't? What were those surprises that you didn't predict? What was missing from your planning that would be important for future activities? Now is the time to sit down with your colleague from all sectors. Discuss these issues and develop better ways to respond to outbreaks in the future. It is essential to document these or discussion, perhaps even communicate these lessons more broadly, for example, in the scientific literatures or at international conferences. That's all who need to know benefit from your experiences. Even more important than documentation is to work these lessons into revised structures, strategies, and plans for communicable diseases, prevention, and control. After all, otherwise you risk making the same mistake the next time an outbreak comes along. At the end of recovery stage, you will be looping back to the preparedness phase, but this time you want that preparedness phase to incorporate all the lessons you learned during this outbreak. So far, we talked about the animals, environmental, and human health sectors playing well together in the ideal world. But reality and challenging, what challenges can we expect when talking at One Health approach? So in this preparedness phase, engagement can be a big issue. There's no outbreak. So where there is a sense of urgency, each sector is busy with their own worries and concerns. During this peacetime, it is a challenge to create a sense of urgency and to priorities One Health activities like stakeholders, liaisons, relationships, buildings, and simulation exercises. Short-term thinking can increase these barriers. Often people don't see the benefit until it is too late. So the animal, environmental, and human health sectors have historically been set up in silos with different priorities, separate budgets, different regulatory frameworks, and little interaction with each other. So this can create a challenge in all phases. Silos working can compromise the alert phase, where the information and intelligence are not shared between the sectors and misinterpreted. For example, veterinary public health and the threats posed by zoonoses is a major part of the veterinary trainings. But this is not always the case of human health education. Therefore, human public health workers might underestimate the genetic threats. Even
I'm sorry to interrupt, but I would request you to please half in 5 minutes because we are already running over time.
Okay.
Thank you.
During the outbreak response phase, the large number of stakeholders involved bringing diseases under the control can lead to chaotic and confusing response. So there is a need to clear and lines of command and communications. However, outbreaks are often so fast-paced that it can be tough to stay on top of all developments. Also, each participating sectors will inevitably have different priorities regarding the controlling zoonosis. For example, for the animal health authorities, impact on trade of animal products and economic are paramount, where the disease case is primary focus for the public health colleagues. This can lead to a conflict of the information should be shared and when. For example, is it fair to share the precise locations of infected farms if this will have a devastating economic effects for the farmers and damaging the relationship between the animal health authorities and their stakeholders? So, on the other hand, is it fair not share these farms locations if it means that the public health authorities can define which human settlements are most at risk and take action accordingly? Another example would be the mass spraying of insecticides. This might be useful to prevent the spread of vector-borne diseases in humans, but it can have far wider ranging impact on the area's overall ecology. And so the environmental sector might have justified concerns These are the kind of questions to which there is no right answer because it depends on the stakeholder perspective. That is why we need to well-defined, well-prepared structures to agree on the roles and responsibilities. We need to understand early who is in charge of generating evidence on health risk and who is in charge of using such evidence to take decisions. And different perspective can also impact the recovery phase because the sector may have a different views on what worked well and what didn't, or it put another way, what worked well for one sector may have been disastrous for another. It is essential to have an honest and open discussion that it is this stage to respect and appreciate each other's viewpoint and to recognize that concern may not always be achievable. So many of these challenges can be mitigated by having trusting relationships with your One Health colleagues that have been developed over the several years rather than the convened in an emergency. But the trouble is that not all of your colleagues will have been trained in the One Health mindset, and that in itself can become a barrier to multi-sectoral working. That is why it is essential part to spread the word about the One Health. Let your human health colleagues know how intersecting and fun it is and direct them to more information and like this. The more people who know about One Health, the better our responsibility will be. So One Health will win. So there is the need, there's such kind of webinar to aware the people about the One Health board. So this is all about Madam Hazima, and we have a third part now. If you allow, I will start. Hello.
Dr. Tariq, thank you very much. I wish we had time to discuss and talk about the third part of your very nice and comprehensive presentation. However, as we know that we are already running over time, and therefore I request you to please let's have question and answers. Sir, will you please allow me to take questions for you?
Yeah. Okay. I think we should keep third part in the next week. We can elaborate about the animal health sector. If you have any question, I'm ready here.
Okay, sure, sir. I'll get back to you on this, inshallah. So I see that there are not many questions in the chat box, but there are many comments regarding your very nice and comprehensive presentation. So, dear participants, if any of you have any question, kindly ask, write it in our chat box so we can take it for Dr. Tariq.
Yeah.
Please write your questions in the chat box.
If you have a question, please raise a hand and ask the question. I'm ready. I'm here to respond to your questions. Participants, have you questions? Please raise the hand.
Okay, Mr. Ibrahim, Mr. Abdul Rahman Mashir, kindly write your question in the chat box because we do not have, permission to open your mics. Please write your question in the chat box. And I'm very happy to note that we have had more than 50 participants joining us for this webinar. And I would also like to thank Dr. Tariq for his time and a very well put together presentation. I wish we had more time to delve into the third part of this very nice presentation. So I see that there are no questions in the chat box. So Dr. Tarek, thank you very much.
Yeah. I checked the chat box. I think in the chat box there are no questions, just suggestions and links are shared by the participants.
So there are just comments for your very nice presentation. Other than this, if there are any comments or suggestions, I'll share that with you once we have
Thank you.
the data of all the comments in chat box.
For the participants, you may ask the questions. If you have any query and question, you send me an email or you send me a text through Dr. Hazima or directly approach to me. And the third part is due to some time constraint and due to technical internet connective issues, we are unable to deliver third part animal perspectives, animal health perspective to One Health zoonotic outbreaks. So inshallah, we will deliver lectures on animal health perspective on One Health zoonotic outbreak in the next time when Dr. Hazima arrange a webinar. So if you have any question, I'm here. I'm ready to respond your question. Please raise your hand or
I guess
send the question in the inbox.
there are no questions in the chat box. Just good comments from your presentation. Thank you very much for your time and for your talk with this. Thanks. Goodbye from our side. Thank you very much. Bye bye. Thank you very much, participants, for your time and very much. Bye bye.
Thank you.